All right. Good evening and welcome to this session of Renew Life After Cancer. This evening's presentation is with Dr. Scott Adams. Dr. Adams is a physiologist and scientist with more than 15 years of clinical and research experience developing and testing the effects of exercise-based interventions for people living with and after cancer. He is the founder and CEO of Cancer Fatigue Services, Canada's first medical treatment service for people living with cancer-related fatigue. He is also the co-chair of the Cardio-Oncology Rehabilitation and Exercise Working Group of the International Cardio-Oncology Society. Following his PhD at the University of Alberta, he completed 2 postdoctoral fellowships at Memorial Sloan Kettering Cancer Center in New York and the University of Toronto. So we're really happy that he is able to join us for the Renew program. Without further ado, I'll let you take it away.
Awesome. Thank you, Shannon. Everyone hear me okay? I'm going to assume no news is good news here. Um, and can people see my screen all right? Yeah, I'm recording.
Yes.
Perfect. Okay, so I guess to just set the table a little bit for tonight, I love chatting about this stuff. Um, it's sometimes difficult to have big group conversations about something like this simply because everyone's medical history and needs and considerations are so different from one another that sometimes it's hard to give generalized answers, but I will do my best. And anyone who wants to stick around after the fact, as long as Shannon is okay doing so, I'm happy to stick around for a couple minutes afterwards and chat if anybody has any specific questions. And like Shannon said, these slides will be presented to you, so you don't need to worry about writing anything down. So, without further ado, I like to start off talks like this getting a feel for the general beliefs of the people that I'm speaking to. So, as an audience participation part, what does the concept of survivorship mean to you? What does it mean to be a survivor? And please feel free to type in the chat, unmute, and talk about it. Any thoughts here? I have never been in a room, virtual or otherwise, where people don't have opinions. Any thoughts about what survivorship means? What does it mean to survive or to be a survivor? Not everyone resonates with that word, but what does it mean to you?
In the chat, Davina says, be able to live life to the full.
Hey, love it. Anyone else? I won't belabor it and be mean. Anyone else? All right. So, when I ask this question in group settings, responses I typically get are related to being able to maintain one's independence, living, but not just living, living well, and obviously surviving whatever it is that you have encountered. Now the question becomes, what can you do to protect yourself? Because we know that, and I don't want to dwell on the negative here, but we know that cancer diagnoses and cancer treatments are associated with the development of physical health risks like cardiovascular disease, metabolic syndrome, hormone imbalances, mental health risks, challenges with emotional states or emotional challenges rather, like depression or anxiety, feelings of isolation, body image concerns. And we also know that these things are linked to one another. Whereas if one develops, you may be more at greater risk of developing the other. So wherever the risk starts, it's important to address. We also know that there are more complex health issues too that involves some physical components, some mental and emotional components like cancer-related fatigue and sleep disorders. So the question is, what can you do to protect yourself when cancer diagnoses and cancer treatments can present such a considerable challenge to maintaining your independence, living well, and surviving? And since you all showed up today, I'm assuming that no one will be surprised when I say you should exercise. The simple truth is, exercise is an extremely effective therapy to address many health concerns in people living with and after cancer. And what I'd like to skim through together is a summary of the evidence that talks about the role of exercise and what research in the area has shown us about how it can benefit people across the cancer survivorship continuum. So a question to frame the discussion: when is it the right time to start exercising? When is it good to start exercising? And we'll dig in the prevention context. And I know we're all here not necessarily to learn about the prevention context, but picture it more as in preventing recurrence, because we know there's comparable or similar literature to support the benefits there too. So looking at the role of exercise in preventing cancer, we see that across many common types of exercise, there is actually strong evidence to show that regular engagement in physical activity and exercise can significantly reduce your risk of developing cancer. And lesser evidence, or lesser quality evidence, or lesser amount of evidence to support the risk reduction in other with people in people living with other diagnoses or at risk of other diagnoses, but more evidence is accumulating all the time. You can see even this is several years old right now as a literature source. So we'll skip past that again to keep it more relevant to people, but know that those numbers, if there are drugs that reduce people's risks by that amount, they're on the market. So it's not a nothing intervention. So what about beginning exercise at the time of diagnosis? And how I like to explain it is, you can prepare yourself mentally, emotionally, physically for subsequent injuries or subsequent stressors. And if you do it right, there could be an important protective effect. And to illustrate the difference here, what I'll do is, what we have here is a typical trajectory of someone, in this case, who was diagnosed, underwent surgery, recovered a little bit, started treatment, was able to finish treatment, and then survived years into recovery. And you can see that without intervention, and pick your measure of well-being, whether it's a measure of fitness or quality of life, you can see that there is a fairly predictable trend with multiple different measures across the trajectory of cancer survivorship. And in the preoperative setting, we call this type of exercise prehab, we see that there's a real potential to build a physiologic or a cognitive or a mental or emotional buffer that will protect you once the surgery or the injury presents. And when we look at the data, we see that exercise before surgeries, or exercise in a prehabilitation context, improves aerobic fitness, physical function, and body composition. It improves psychosocial outcomes, including cognitive function, coping skills, depression, and anxiety. And when we consider post-operative outcomes or clinical outcomes following a surgery, we know that the number of complications can be reduced, the time spent in hospital can be reduced, mortality risk can be reduced, risk of secondary side effects is reduced. So there's a lot that could be done from a prevention context by engaging in protective health behaviors like exercise before a surgery. Next, looking at cancer treatment now, how it can help people. So if we follow that same path, if we've done our job right, we may have been able to build a bit of a physical buffer or a physiological buffer or an emotional buffer before the surgery. And then inevitably the event happens and people's function drops off or quality of life drops off, and it will start to recover a little bit, which is why there's some recovery time between these interventions, often, not always. And then treatment starts. Again, if we do our job right, exercise can help decrease the severity of the subsequent declines in physical function, emotional challenges, or emotional well-being, and so on. So you'll notice, I hope you'll start to see some consistent patterns here. So when we look at systematic reviews, which combine the findings of many different studies, we see that exercise during treatment can improve fitness, help control blood pressure, improve body composition, help normalize or stabilize blood counts, reduce fatigue, and boost energy. We also see that it's helpful from the psychosocial outcome perspective as well. So improving quality of life, cognitive function, helping people sleep better, sometimes related to helping to control symptoms, where you see there where the improved cognitive function, the improved quality of life, the improved sleep may be a result of exercise's effect on controlling treatment side effects. And there's also some, not super convincing evidence yet, but some evidence to suggest that exercise can actually help improve treatment completion rates too. Again, stay tuned for that. I won't hang my hat on it until I see better data. And now shifting gears to this last piece, or last great big stage, we hope, looking at the effects of exercise during cancer recovery. So if we've done our job well, we've been able to stay close to our baseline function, and after treatment is finished, hopefully it can expedite or accelerate the rate with which we recover after treatment has finished, and sometimes being able to achieve better function than people had at baseline. I'm going to sound like a broken record here, but look at the consistency with which we see that exercise improves things that are important to people. Improving their function, reducing their fatigue, improving their body composition, improving people's bone mineral density, decreasing emotional distress, decreasing cognitive challenges. And then long-term, controlling the secondary or late, the risk of late occurring effects like cardiovascular disease and related mortality. There's no drug on the market that can do all of these things for you. It is an extremely potent intervention. And as you can see, I'm pretty biased towards it, but I cannot stress enough how potentially beneficial it might be. And I said at the beginning that we were looking at the effects of exercise on preventing cancer occurrence. Well, now we've got a sort of split screen here where we're looking at the effects of pre-diagnosis physical activity on long-term survival, as well as post-diagnosis physical activity on long-term survival. Look at how consistent they are. And I'll go through one result first just to help you contextualize it, and then you'll be able to interpret it fairly easily on your own when you receive the slides. So if we just look at the start here, we see that there were 17 studies included in this. The relative risk or the risk reduction decreased by 18%. And you know that if this 95% confidence interval, you know that if the numbers within these brackets don't cross 1, then it's a significant effect. So I've highlighted all the boxes and all the groups for which exercise pre-diagnosis and post-diagnosis is associated with risk reductions in mortality, both for cancer-specific mortality and all-cause mortality. That's most of the groups studied. Again, there is no more potent intervention that can benefit multiple aspects of your life than exercise. This is a study that I helped support when I was at Sloan Kettering in New York, and we were looking at the effects of vigorous intensity physical activity in adult survivors of pediatric cancers. So this was all done through the childhood cancer survivorship study. We pulled some of their historic data, and we looked at people who were diagnosed between 1970 and 1999. And on average, the group was about 18 years post-treatment. And we had two questions in mind. First, we wanted to see what the benefits were of engaging in vigorous intensity physical activity based on what they were doing at their baseline survey in 1992. We had data on about 15,000 people at that point, and the effects of vigorous intensity physical activity participation at 20 years follow-up. That was our first question. And then our second question is, what happens even if people weren't doing physical activity at survey 1? What happens if they changed their behavior? Was there any benefit to changing your exercise or your physical activity behavior? So we collected data that was about 8 years following the first survey. We had about 5,500 individuals at that second survey. And we looked at the effects of what happens if people changed their vigorous intensity physical activity behavior over time. And this is what we found. So question 1, vigorous intensity physical activity at baseline and the risk of mortality 20 years later. So what we did is we compared groups who were doing no vigorous intensity physical activity and 15 to 18 MET hours of work per week. This is not 15 to 18 MET hours of exercise per week. That's crazy. Nobody has time for that. I will explain what that is. But when we compared these two groups, we saw that there was a 42% risk reduction in mortality risk just between people who were doing no vigorous intensity physical activity and people who were doing some. And to help understand what 15 to 18 MET hours of work is or translates to, it's like playing badminton or soccer for an hour a week, plus maybe dancing for 30 minutes twice a week, and going for a bike ride for 30 minutes twice a week. So I hope it's less daunting than thinking about doing anything, any sort of exercise for 15 to 18 hours. We're really talking about at most 3 hours of activities that could actually be quite enjoyable, and a 42% risk reduction in mortality. That's tremendous. Now remember our second question. We are interested in understanding what the effects of changing your exercise behavior over time were. And we saw that people who started doing no vigorous intensity physical activity and added just 6 MET hours of work per week experienced a 40% risk, or had a 40% reduced risk of mortality at that secondary survey. I'm going to say it again. There is no drug on the market that reduces your risk of important things like exercise, especially in this context. And to explain what that 6 MET hours of work is, it's the equivalent of going for 2 30-minute hikes twice a week, or we're not adding them this time, or maybe climbing stairs for 15 minutes 3 times a week. And assuming your knees and hips are cooperating with you and you don't have any sort of unreasonable peripheral neuropathy, people can achieve this. So this is something that is within reason for most people. So I think the really important take home here is it's never too late. Even if you're not doing things like vigorous intensity physical activity, know that it's never too late to get started, and it can have dramatic effects on reducing your health risks. Any questions about that before we get going, before we go into the next section? I can't see the chat, so Shannon, I'll rely on you to let me know if we have anything. So to wrap up, as a quick overview for this section, we know that for people living both with and after cancer, exercise is feasible and safe. It improves clinical, physical, and psychosocial health outcomes, and it can improve both your quality and length of life. Find me a drug that can do all of that, and I don't know what I want to promise here, because maybe there's something out there, but I've yet to hear of it. So I'll be semi-confident in my boastful claim here. All right. So now we know what the benefits of exercise are across the entire continuum of cancer survivorship. But how do we get into it? What are people supposed to be doing? And the rest. So, first of all, as you should expect, your medical management should be tailored specifically to your health risks and needs. Your exercise should similarly be tailored specifically to your health concerns and needs. And we personalize exercise and describe how we personalize exercise using something called the FIT principle. The FIT principle describes the frequency, or how often you exercise, the intensity, how hard it is, how difficult or strenuous your exercise is, the time that you're exercising per session, and what kind of exercise you're doing, because not all types of exercise are equal. So I get this question all the time: what kinds of exercises do I need to do? And the simple way I like to explain it, oh, that's a waiting room there. The simple way that I like to explain it is aerobic exercises can be considered those that help you live longer, and resistance exercise and stretching and flexibility exercise help people live better. And I dare say that I would assume most people attending today would love to enjoy both general sets of benefits. So, starting with aerobic exercise. Aerobic exercise is the type of exercise that increases your heart and lung activity and improves the way your body utilizes oxygen. Another question I get all the time is, how much exercise do I have to do? And with a little experience, I've come to understand that what people really mean by this question is this question: what is the least amount of exercise I can do that will still benefit me? The answer to that is really a function of what you're trying to achieve and what your health risks are. Like I said, there's no clear-cut sort of answers here, but we could talk about it a bit. So aerobic exercise ideally should be performed most days a week. We want to try and avoid, if possible, the weekend warrior pattern where we are sedentary Monday to Friday and try and fit in all our physical activity on the weekend, which predisposes us to overdoing it and injuring ourselves. And we have some specific examples that we can get into in the following slides. Another question we get is, how hard should I be working? And we have some intensity, or we have some outcome specific recommendations depending on what outcomes you're trying to improve. Like improving your fitness generally responds better to a certain strenuous strain level or intensity of exercise, whereas trying to improve your metabolic health, so how your body controls your blood sugar levels and so on, that responds to a different stress level or intensity of exercise. But in general, moderate exercise seems to be consistently beneficial across outcomes, and we define moderate intensity exercise in a couple ways. So it can be, if you're using heart rate, it's 64 to less than 76% of your heart rate max, 46 to 64% of your VO2 max, or your body's peak ability to intake oxygen, transport it to the muscles, and turn it into energy, or a rating of perceived exertion of 12 to 13 on 20, which is described in words as either fairly light or somewhat hard. Now, like I said, certain types of outcomes, I got ahead of myself here. Certain types of outcomes will be differentially affected based on the intensity of exercise you're doing. And I already gave two of those examples. And we can see that improving your lymph circulation, for people who have lymphedema concerns, that can be achieved even at lighter intensities of exercise. So then how are we monitoring our training intensity? And I think there was a question about this in the weeks preceding this talk, and I'm happy to get into some specifics at the end of this talk if people want to stick around and chat. But something that we can all do to estimate what our target training intensity range if we're looking to achieve a moderate intensity of exercise. So it starts off by taking the number 220 and subtracting your age. That's your theoretical maximum heart rate. Then you want to take that maximum heart rate and multiply it by the percentage or the intensity that you're trying to achieve. So for example, a 55-year-old who's looking to achieve between 64 and 75% of their heart rate max, they subtract 55 from 220 and they get 165. Then, if they're trying to identify what 64% of their heart rate max would be, they multiply 165 by 0.64 and they get the low end of their target training intensity range. And they just repeat that process for the 75th percent of their max heart rate. So then you can see this person would have, for a moderate intensity of exercise, would have a target heart rate range of 106 to 124 beats per minute. Any questions about that? Moving right along. What if you don't have a great heart rate monitor, or what if it's bugging out on you a little bit? There are other ways to estimate the intensity of your exercise. So one is called a rating of perceived exertion, and that's simply checking in with yourself and self-reporting how strenuous your exercise is. And there's different ways to measure it. Sometimes it makes sense to measure it on a 0 to 10 scale. That's the most intuitive. There are others that you saw, I said before, the moderate intensity range was 12 to 13. So that's on a 6 to 20 scale. So that 3 to 5 out of 10, or a 6 to 20, or a 12 or 13 out of 20 is that moderate intensity range. Another way to do it is through the talk test. And I use this all the time. And admittedly, I look like the crazy person walking or running around or on my bike, talking to myself. But as long as you've headphones in, you can kind of fake that you're actually on the phone with someone. But it's a very simple test, and it pretty reliably gives you a reproducible indication of how hard you're working. So what it requires you do is as you are exercising, you try speaking aloud. And if you're working at a light intensity of exercise, so below your anaerobic threshold, you can carry on complete conversations, finishing full sentences, never needing to stop and take a breath mid-sentence. If you're working at a moderate intensity of exercise, you will have to pause occasionally in the middle of your sentences, but you can mostly maintain normal conversation. Progress that intensity to vigorous intensity, and every couple of words, you may have to stop to take another breath because you're working so hard. Your speech and your muscles are competing for the same oxygen. So next time you're out and you're wondering how hard you're working, and if you don't mind looking like the person talking to themselves, try it out. It can be a nice, reliable way, inexpensive. You could do it anywhere, unless you're swimming. You could do it anywhere to help estimate how hard you're working. In terms of the duration of exercise, it's recommended that people try and aim for at least 30 minutes per session, targeting up to 150 minutes of moderate to vigorous intensity exercise per week. Now, Again, you may have to vary that training time target depending on what outcome you're seeking to improve. But it's really important to understand that, and especially for people who look at that number, 30 minutes per session, and think exercise is not for me, you can break it down. You can break it down into very short bouts and accumulate them over your day. There's actually been some work done out of UBC and McMaster looking at exercise snacks, where they'll do 30 seconds or a minute of maximal intensity exercise, one bout in the morning, one bout at lunch, and one bout at the end of the day. So we're talking between 90 seconds and 3 minutes. And there's fitness improvements associated with it. So we are learning more and more about all the different ways that we can fit exercise into our life, but don't be discouraged when you see a general recommendation like 30 minutes per session, because it is totally legitimate to break that number up into smaller sections to make it more achievable for you. Audience participation part. Of all the different types of aerobic exercise, which type of exercise is most beneficial? What's the very, very best type of aerobic exercise for you?
I would say walking.
Walking? We have one vote for walking.
Work out at the gym. Work out at the gym.
Working out at the gym? What are you doing at the gym, my friend?
I push weights. I alternate between pushing, pulling, lower body, and back.
Right, so that's resistance exercise. We're going to talk about that next, but now we're talking about aerobic exercise. What kind of aerobic exercise, if I go back playing a sport, riding a bike, swimming, climbing stairs, walking, dancing, anything else, what kind of aerobic exercise is the very best one for you?
We've got a running in the chat.
Running, love it. One for walking, one for running.
Elliptical.
Elliptical, really good on the knees. So now this is where you start to resent me, because I say the real answer is anything that you will do. There are some differences between the different types of exercise, but to benefit from it, you just need to find something you like to do and do enough of it, and you will experience the benefits of it. Sorry for being a smart aleck. Now, Mr. Is it Wong?
Yes.
Now we're starting to talk about resistance exercise. So resistance or strengthening exercises requires that you lift a weight or resist a weight against gravity. You're resisting against a force. And this type of work will actually make you stronger. It'll strengthen your bone mineral density, or increase your bone mineral density, and it'll make day-to-day living easier for you. Remember, this is one of the types of living well exercises. The general recommendations for, again, cancer survivors, whether you're living with or after, is at least 2 days a week, at least 2 sets at 60% or more of your 1 repetition max. We can talk about how to figure that out later on. Ideally, you want to be doing between 8 and 15 repetitions per exercise. And there are lots of ways that you can achieve this kind of resistance. So for example, earlier today in the middle of the afternoon, I was getting a little sleepy. So I went out to my living room and I did some push-ups and sit-ups until I ached and I was feeling awake. That's an example of a calisthenics-based exercise where you don't need fancy equipment and machines to achieve the resistance, the application of resistance. You can use free weights or machines if you have access to them, and resistance bands are great because they too are flexible. They can go to parks, they can be wedged into doorways and things. There are lots of ways to apply resistance. It's important too that if you're trying to strengthen and build your muscle, that you maintain the muscle's natural length. and help with your coordination. And you can achieve that through regular stretching and flexibility exercises. Yeah, there are different schools of thought as to when it's the best time to stretch, but and there are different ways to apply it. But generally, as long as you're not doing anything too strenuous, probably better that you stretch after exercise, especially if you're trying to lift weights, because strength or stretching the muscles that you are about to use to lift those weights actually decreases your strength a little bit, because some part of your body's ability to generate force is based on an elastic potential property within the muscle. And if you stretch before you lift a bunch of weights, you are stretching that elastic potential energy out of your muscle. So it's not going to be a huge difference, but if you're serious about your strengthening exercise, probably better to save your stretching for after the fact. Now, there are no consistent recommendations for cancer survivors with respect to flexibility, but we can adapt guidance from the general population that says you should be stretching 2 to 3 times a week, 2 to 4 sets for each muscle. You should stretch to a point where you feel a pull but not pain. You should hold each stretch for between 10 and 30 seconds. And there are different ways that you can achieve your stretching goals. More dynamic moving stretches. These types of stretches are actually more appropriate for a warm-up or a cool down before or after an activity. And it's really the static stretches that I was talking about, where you're striking a pose and you're holding that pose for an extended period of time, that reduces the elastic potential energy. But there are other activities beyond stretching, like yoga and Tai Chi, that are great for lengthening muscles and helping you achieve your stretching goals. Any questions about any of that? Moving right along. You're letting me off easy tonight. I appreciate it. Okay, so some basic tips and tricks and key how-tos for exercise, starting with warm-ups. Ideally, you want to be doing at least 5 to 10 minutes of light to moderate intensity aerobic exercise. And you should be doing that before you lift weights or before you do an actual aerobic exercise session. The reason is different depending on what you're about to do. The reason you would want to do a warm-up activity before aerobic exercise is it actually pushes more blood. It restricts blood flow to the core and pushes more blood flow to your extremities so that you can deliver more oxygen to do more work when you're doing your walking or cycling or dancing or whatever it is that you're doing. Conversely, when you're warming up, when you're doing 5 to 10 minutes of moderate or light to moderate intensity aerobic exercise before lifting weights, that doesn't help you perform better in actually lifting the weight, but what it does is it helps increase your blood flow so that your body can remove the metabolic byproducts that are created, the lactic acid, when you're doing the resistive work. So it helps you recover faster between sets. You can also be doing, you should also be incorporating cool downs into your routine. So again, 5 to 10 minutes at a lesser intensity than when you were training. And if anyone has ever been exercising or been moving around at a strenuous rate and stopped suddenly, they may have got lightheaded. This is expected because what's happened is between your heart and the muscles around your blood vessels, our bodies are really good at pushing blood away from the heart to our muscles. But once the red blood cells go through the capillaries where all the gas exchange happens, on the far side of your capillaries, your blood pressure is effectively zero. So you have no driving force to return that blood from your feet, if you're vertical, from your feet up to your heart. So your veins have a series of one-way valves in them. And every time the muscle around a vein contracts, it squeezes blood from one section of the vein up to the next. So if you are exercising vigorously and your heart's going quite quickly, it takes a little while for your heart rate to slow down. So if you're exercising vigorously and you stop abruptly, you've got a lot of drive pushing blood away from your heart. And because you've stopped moving your legs, you've got very little drive or no drive returning the blood to your heart. So your blood pools in your extremities, and the first place you feel that is in your head. You get lightheaded, sometimes passing out, and that's your body's way of forcing you to get into a position where it doesn't need to work against gravity to get blood to your brain. So it's actually a protective mechanism. Hydration is important, obviously, especially when our hydration status can be affected by some of the medications we're taking or changes in diet, and especially important if you're working out in warm or humid climates. And breathing, something that isn't discussed too often, is your pattern of breathing when you're lifting weights. We have a reflex that causes us to hold our breath when we are exerting ourselves. So the way our body works is when we're trying to lift something heavy, our natural reflex is to hold our breath. That's supposed to stabilize our core and increase our ability to generate force. But unintentionally, what it also does is it causes an acute spike in blood pressure. So to combat that and to avoid those acute spikes in blood pressure, it's as easy as squeezing your core, keeping it tight before you're about to lift the weight, and then making sure that you're breathing out while you lift the weight. Because your intrathoracic pressure can't go up if you're actively releasing air from your lungs. Okay, so it's a little safety tip. It takes a bit of practice to get used to breathing out when you're doing the work, but it's a good idea overall. So we know that exercise is safe for when it's done properly. Even for people with lymphedema, people with more advanced health concerns, exercise can be done by almost everyone as long as it's approached properly. Keys to doing it yourself or under the supervision of others, you want to make sure that you're working up within your limits and up to your limit to induce beneficial changes, but not to push yourself too hard, because that's where the overuse and the injury happens. There's some concern back in the day that people were nervous that increasing exercise levels or people who have active cancers in their body, have tumors growing in their body, may make it more likely that tumors spread or that the disease metastasizes. And they did some cool animal research. I know that's a touchy subject for some, but they did some cool research, not in humans, and they found that in the exercising animals, the tumors didn't grow anymore and the diseases didn't spread anymore. But an accidental finding is that in the exercising animals, in the next group of exercising animals, they were wondering what would happen if they introduced chemotherapy. So they had two groups of animals, some exercised, some didn't, and when they introduced chemotherapy, the tumors of the animals that exercised shrunk more. And when they looked at why, when they removed the tumors and looked at why, they saw that tumors grow very erratically, and when you have irregular tissue growth, blood vessels also incompletely form or aren't evenly distributed throughout the tumors, which causes all kinds of circulatory problems. And when you're using systemic treatments like chemotherapy, well, the only way they're delivered is through your blood vessels. So if you've got large parts of your tumor that don't have good blood supply, well, the chemo can't get there. And what they found is by exercising, it actually improved the health of the blood vessels and normalized the distribution of blood vessels within the tumor, so that when they introduced chemotherapy, the tumors shrunk more. So that's a really cool additive effect. If you know you have some upcoming treatments, get training, because if you can improve the blood vessel distribution in your tumor, it could actually help your tumors respond better. Yeah, there's no evidence to I kind of just talked about this, no evidence to suggest that exercise will make the disease, any cancers any worse or the side effects worse. But given how different everyone's health status and concerns are, it's almost always a good idea to at least go engage with your doctor to better understand what your risks are and, pardon me, to what extent it's safe for you to begin exercising autonomously versus under someone's supervision. In general, if we had to talk in general terms, some tips for it: start low and progress slow. Monitor the intensity of your exercise. Don't set yourself up for failure or injury by overdoing it. Pay attention to your body. Use the different ways we talked about for monitoring exercise intensity, and make sure you're doing an appropriate level of it. Wearing clothing that's important. We know we're in Canada. Now, you're a little south of where I am, but it's climate is subject to change at short notice, so it's important that we're always dressed appropriately. Drinking lots of water, exercising with a partner can help make it fun and help ensure that you're safe should something happen. And doing things that you're familiar with or comfortable with. Remember, the best type of aerobic exercise is the one that you'll do. For resistance training, it's absolutely more important that you nail the technique before you start concerning yourself with lifting extra weights. If we're again talking in general terms, it's generally speaking safe to increase your repetitions before you increase the weight that you're lifting. And keep in mind that muscles have different sizes. So the muscles in your arm are smaller than the muscles in your leg. So it makes sense that you would use smaller weights when you're trying to stress the muscles in your arm. When people do too much of anything, whether it's eating or watching TV or even exercising, we can predispose ourselves to injury or wasting or negative changes in the body. So it's good to frequently change up your routine so you don't overdo it with any one specific movement pattern. It's really important that you give your body time to recover between resistance training bouts, because quite literally what you're doing is causing small micro tears in the muscle that when they heal, will heal stronger and larger to actually help improve your muscle mass and your muscular strength. So give yourself enough time to recover from that intentional stress before lifting weights with those same muscle groups again. And it is totally normal to feel that discomfort. Remember, you're intentionally causing micro tears. It's normal to feel a little achy following resistance training sessions. Pain is not acceptable. So if you're experiencing pain after an exercise session, you've probably done too much and you can scale it back a little bit. Now, if we are talking about general guidelines for people living with and after cancer, there are some general recommendations put out recently by the American College of Sports Medicine. And I'm not going to go through all the details of the following slides, but I've highlighted a bunch of areas, and you'll see this on the slides that you receive. I've highlighted a bunch of just key things to point out when we review the slides. So according to the American College of Sports Medicine, it is generally safe and generally beneficial to improve different health outcomes, physical, mental, emotional health outcomes, by doing at least 30 minutes of moderate intensity aerobic exercise at least 3 days a week, and lifting weights that are at least 60% of your 1 rep max, 2 sets, 8 to 15 reps, at least twice a week. Those are the general guidelines. But there are also outcome-specific guidelines. So here we're looking at the general recommendations to improve anxiety levels in cancer survivors. And we can see here that where there is no evidence, these guidelines will say so. And when there are differences between exercise approaches, these guidelines or these tables will say so. So here you can see that when you look at all the science or the studies done in this area, you see that supervised exercise seems to be more effective at reducing anxiety levels than unsupervised exercise in terms of aerobic exercise. And similarly, with combined aerobic and resistance exercise, supervised or a combination of supervised and unsupervised exercise seems to be more effective.
Dr. Adams,
Yes, sir.
the
And please, Scott is absolutely fine.
okay, Scott. First column, intensity. What does VO2 max stands for?
The amount of oxygen that your body can consume and turn into energy.
We cannot measure that, right?
Well, you can measure it, but you need the equipment I have in my clinic to measure it. You can estimate it using different approaches. There are prediction equations that are available, but the best way to do it is to actually do a cardiopulmonary exercise test. And I'm happy to tell you more about that and maybe try and connect you with some resources if that's something you're interested in doing.
Okay, thank you.
Of course. So here we see that moderate to vigorous intensity exercise has a greater benefit at reducing anxiety than light to moderate intensity exercise. Okay, so I'm going to stick to just calling out some of these key features over the next couple of slides. They're all structured the same, similarly easy to interpret once you know what you're looking at here. So this is exercise benefits to improve depressive symptoms. Again, not great evidence for resistance exercise. Again, supervised or a combination of supervised and unsupervised exercise is more effective at improving depressive symptoms than unsupervised exercise alone. And there seems to be a dose-dependent benefit or a ceiling effect of doing up to 180 minutes a week, where there doesn't seem to be more benefits doing more aerobic exercise beyond that. For fatigue, you see that now aerobic exercise, resistance, and the combination seem to have some evidence to support their benefits with different intensity ranges, and that it can be either supervised or unsupervised, can be similarly beneficial, always with the understanding that as long as you're doing it right. And with aerobic exercise in particular, there seems to be a benefit of sessions that last longer. And what I think is driving that is by causing tissue desaturation and pushing your body for longer periods of time, you're actually increasing the volume and the function, the number, the volume, and the function of the mitochondria within your skeletal muscle. And that's really important from a fatigue perspective because it's the mitochondria that produce energy for your body. So this is one of our actual intervention targets when we're working with people. There is no evidence of benefit doing light intensity aerobic exercise at improving fatigue. So if fatigue is something that you have concerns about, the old adage is some is better than none. Well, there isn't much evidence to suggest that light intensity exercise actually helps improve fatigue levels. I think you get the point. Different combinations of supervised for aerobic seems to be more effective. Supervised or combined resistance exercise seems to be more effective, and supervised seems to be more effective when you're combining aerobic exercise and resistance relative to completely unsupervised exercise. The combination at improving health-related quality of life, the combination of aerobic exercise and resistance exercise is the most effective. And that makes sense. Remember what I was saying with resistance training being the live better or live well approach to exercise. So combining the two gives you the best improvements in your health-related quality of life. And lymphedema, there's really no evidence for aerobic or combined aerobic and resistance exercise improving lymphedema. We know resistance exercise is safe and effective at improving it, with the understanding that most of the studies that have tested this start with supervised exercise to teach the person doing it, and then they can transition into unsupervised exercise. We always start really slow and progress really low and progress slowly. And that while there's no evidence of benefit, there isn't any evidence of risk either. So when people with lymphedema are doing aerobic exercise, there's no, as long as you're monitoring things appropriately and wearing the right protective garments, compression sleeves and such, there's no risk that you're going to make your lymphedema worse, as long as you're taking those precautions. Same thing, and I'm getting pretty long on time here, so I think you get the point. So I'll skip by here, and all of this information, again, will be on the slides that you receive. So the last section is really focusing on key considerations to make sure your exercise is safe and effective and giving you the best chance of success. Just before we get there, are there any questions? Do we need to pause for a couple of minutes for a quick bathroom break or anything?
When you talk about supervised training or whatever, there's a lot of online courses or apps on your phone that for exercising, etc. Is that something that would be considered supervised, or is that not supervised?
As long as there's a person monitoring your sessions and following up with your progress and staying on top of making the right changes at the right time, that's supervised. That can be done virtually, no problem, but it requires that you actually communicate with another person who is supervising your exercise remotely. But just an app that shows you what to do isn't considered supervision. Is that what you were getting at?
Yes, thank you.
Perfect. Great question. Okay, jumping into the last section. So when we're trying to understand how cancer and cancer treatments impact our bodies from an exercise safety and exercise ability perspective, I like to group it like this. So we have local therapies, surgeries, radiotherapies, and systemic therapies, chemotherapy, hormone therapy, targeted therapy, that act differently or have different impacts on your ability to exercise safely or your capacity to exercise. So different types of therapies may predispose people to developing lymphedema, negative changes in their skeletal muscle, bone, fat mass, blood pressure changes, or blood value changes like lower red blood cells, lower white blood cells, lower platelets. Pain can be a big problem that multiple types of therapy can cause and can limit your ability to exercise, skin irritations, and fatigue. When we're considering the effects of local therapy, it all comes down to the systems and the structures that are affected. So we want to make sure that when we are reintroducing exercise following a surgery, we don't do it too soon. I have seen some absolute horror stories of people trying to get back to training too quickly and losing reconstructions and causing massive infections. It's something that needs to be taken seriously. And know too that there are often indwelling devices that may not make it unsafe for you to train, but need to be monitored and need to be worked around when you are trying to exercise. So in often cases, it's just a matter of not going to the end range in a range of motion to do a restricted range of motion and not put too much stress on the site where your PICC line or your portacath is. And the other key factor here is just making sure you're checking the site regularly for signs of irritation, redness, itching, swelling, to make sure you're not overdoing it, and then modifying what you're doing if you see any of that. Same thing for radiotherapy and brachytherapy. It's all about the systems and structures that are affected. The human body is wonderfully complex. So if you draw a straight line through your body in any plane, you're likely going to be hitting multiple different systems. So whether it's a head and neck radiotherapy or a thoracic radiotherapy, which can now be image guided to work around the heart and the lungs as much as possible, all muscles and bones and nervous system, nervous tissue and blood vessels, anything between those where the radiation comes in and where it leaves the body could be affected. Chemotherapy, all the hormone therapy, targeted therapies, the systemic agents, they go everywhere, so you might have symptoms anywhere. It still comes down to what systems and structures are affected, but we know that because these treatments are circulated through your blood vessels, and they will permeate muscles and digestive tissue and perhaps bone, they could impact any part of your body. So if you are experiencing symptoms related to any of these therapies, you may just need to alter your approach to it. So I explained it like an athletic training for an athletic event, where athletes will periodize their training in phase with competition. So they'll build up their training load till they're a little bit before a competition, then taper it right off so their body can recover before they need to perform. So picture it the same way through cycles of chemotherapy or different types of treatment. On days where you're feeling like your energy is a 3 on 10, don't expect a 10 on 10 workout. Adjust what you're doing that day so that you are maintaining alignment with how you're feeling that day. But try and do as much as you can on the days that you're trying to exercise. Be kind to yourself. Lots of us have this inherent tendency to be hard on ourselves if we're not doing things the way we think we should, and there's no place for that here. Fatigue is another complex beast to address, but we see that exercise is the single therapy that is most effective for everyone at addressing cancer-related fatigue, because it positively influences all 10 of the treatable pathways or treatable causes of cancer-related fatigue. Having said that, when you are having a fatigue exacerbation, if you are feeling severe levels of fatigue, there's no point in trying to push yourself. Take breaks before you get to that point in your training. There's still ways to train while fatigued, as long as it's not severe, and do it safely. Energy conservation is really important. People with backgrounds like occupational therapists or social workers, they are really good, or nurses even are really good at helping counsel people with energy conservation and planning their routines to optimize the likelihood of people maintaining their obligations and optimizing their function. Do as much as you can to safely exercise during the time that you have exercise, or that you have energy rather, and be kind to yourself when you don't. Little strategies like planning ahead, making sure you're with someone, you have equipment in case the weather changes, you have a home training option versus an outdoor option. And there will be days when exercise can be the most important thing in your day to help combat the fatigue, but then there'll be other days where you just have to get stuff done, and exercise won't be the most important thing you need to do during your window where you have energy. So there's some planning to be done, but it is absolutely possible to be training when you're dealing with fatigue. Other non-cancer related illnesses and injuries that change the safety and the ability of individuals to exercise are things like people with balance issues, blood pressure issues, diabetes, cardiovascular disease, muscle, bone, or joint issues when people are pregnant or have incontinence issues. I think it's pretty easy to understand how any of these factors may change the safety profile or may impact your ability to exercise safely. If you have concerns, you develop sudden swelling, you're experiencing a sudden shortness of breath, chest pain, your heart begins racing, if you get really dizzy or lightheaded, don't wait, act on it. if you're bruising really easily, if you suddenly start experiencing night sweats, any of these things, don't take chances. Be in touch with your medical team. Make sure it's cleared. It's safe for you to re-engage with whatever the activity was that you were doing. So the good news is the getting started with exercise is simply as challenging as getting the right piece of equipment, right? Of course not. Starting to do anything new without a plan is a recipe for success, or is a recipe for disaster. Flip that. Getting started with a new exercise routine, we're always prioritizing safety first. Talk to your doctor, engage with a therapist so that you can be confident that what you're doing is appropriate. Engaging with a therapist, like I said, can help teach you that the right way to do things, the right things to be on the lookout for when you're training. That could be an early warning sign of a complication. There are certain professional designations like kinesiologists, physiologists, physiotherapists that are specially trained in providing this kind of advice, but not all have cancer experience. So it is absolutely appropriate and important that if you are seeking the advice of a professional, an exercise professional, it is totally appropriate that you ask them about what experience they have, is specifically working with people who are living with or after cancer. Know your limits, pay attention to what your body's telling you. A lot of people start to mistrust their bodies after being diagnosed with cancer. Exercise can be a great way to reconnect with your body and learn to trust it again. When someone, any professional or yourselves, are personalizing your exercise program, it's really important that you take into consideration characteristics of your tumor or of your cancer, what therapies you were exposed to, if you had any pre-existing or health concerns that developed during or after your cancer treatments, understanding what your physical limitations are, keeping in mind what your health or performance goals may be, if you have any preferences, if you have access to certain facilities. All of these things need to be considered when approaching how to personalize an exercise program for you. Goal setting is critically important. Goals without plans are really just wishes. There's a saying that says something like that, but it couldn't be more true. When you look at lots of behavioral research that gets done, planning, goal setting, and planning are two of the most important determinants or predictors of success when engaging in protective health behaviors like exercise or dietary changes or whatever. So find the reason you want to get moving and focus on it. Direct all your time and energy into a program that will help address the specific things, the specific aspects of your life that you want to improve. Setting SMART goals is fairly straightforward. I'm sure you've all heard of versions of this before. You want to be specific. You don't just want to make a goal by saying, I want to move more. You can't hold yourself accountable if you can't quantify it. Making it measurable. So I want to move more, switch it to, I want to not move more, I want to do aerobic exercise, or I want to go for a walk. That's specific. Now we're making it measurable. I want to go for a walk 3 times a week, or 3 times a week for 30 minutes, or for 10 minutes. Don't overshoot. If you set a goal that is outside of your current capacity, whether it's unrealistic or unsafe, you'll set yourself up for failure and discourage yourself in the process. Make the goals important to you. Don't just do something because you know it's the right thing to do. Find something like playing with your grandkids, or getting back to work, or volunteering at a center. Make it something meaningful to you. Make the goal tied to something that's important, and you will be more likely to achieve it. and make it time bound. Hold yourself accountable. Don't make it some nebulous, sometime in the next year, I want to start walking 3 days a week. No. Within the next week, I want to start walking 3 days a week, but I'm going to make it realistic. So week 1, I'm going to walk 1 day. I'm going to do that for 2 weeks in a row. Then week 3 and 4, I'm going to try 2 days. And you can ramp up to where you want to get. Making sure, tips to help you stay on track. Making sure you understand your own specific needs, what personal boundaries and barriers you have, what symptoms, side effects, and schedules you're working around. Start small. Remember I was saying start slow, start with a low weight, progress yourself slowly. Start with small goals and incrementally increase them to challenge yourself. Something that we really encourage people to do is to focus on how they feel after they have done something the first time. Because documenting how you're feeling after you've done something can be the difference maker in the next time you want to put on those walking shoes and you really don't feel like it. Reflecting back, whether it's in a journal or just thinking back to how you felt last time, how good you felt that previous time, can be the difference maker in whether or not you repeat that behavior. Reframing and thought stopping. So we're great at making excuses for ourselves, stopping ourselves abruptly in those tracks to make sure that those excuses don't override our intentions to begin exercising. Be kind to yourself. Don't beat yourself up if you have a bad day, if you miss a session, whatever it is, you can circle back to it. And focus on what you enjoy doing the most. Do the things you like. Find ways to make it fun, listen to music, watch TV to help pass the time. Do it with a friend, do it in a group. Use technology. I'm a numbers guy, so I always tease myself if my watch is out of batteries or my heart rate monitor is out of batteries or I don't have it. Does it really count? Well, yeah, it does, but it almost lessens my motivation somehow if I can't see my results after. Plan for the weather. Set up space in your home to exercise. So I don't know if you can see this. You've got little wall mount straps. Find ways that you can exercise at home so that you can work around changes in your schedule, bad weather, and so on. And I hope there are no dietitians in the audience, because I will say give yourself a little treat after you've done something like exercise to give yourself a bit of a reward. Bringing it all home, we know exercise is safe before, during, and after cancer treatment, as long as it's done right. There is nothing you can do, no drug you can take, no other a therapy or intervention strategy that is so beneficial across multiple aspects of your life. Exercise is a fantastic return on your investment. We know that, and there's growing research to support that, certain types or certain approaches to exercise can target specific or improvements in specific health outcomes. And we're starting to get more specific guidelines around that. And there are many ways that you can be successful with exercise. It involves making a plan. It involves being kind to yourself and adapting when you experience challenges, but there's a way to get there. Acknowledging, of course, that you do need a bit of motivation. Thanks so much. An hour 12. Oh my gosh. People got your money's worth today.
Yeah. Can I ask a question?
Please.
Okay, you mentioned about the heart rate 220 minus age.
Mhm.
Okay, and I calculated mine at 76%. And when I work out at the gym, I always go beyond that. Is there any harm to that?
Nope.
Okay.
As long as you don't have an underlying cardiovascular condition that makes it unsafe, Remember, I showed a slide where certain health outcomes, in this case aerobic fitness, actually respond better. So VO2 peak, you will have greater improvements in VO2 peak by training at a greater intensity of exercise. Your VO2 peak or your aerobic fitness will still improve with a moderate intensity of exercise. It just won't improve as quickly.
Okay, my next question is what's the best way to measure heart rate at the time of exercising? My smartwatch doesn't show the right one. I can tell that.
Yeah, so first check the placement of your smartwatch. Most oftentimes people try and wear it like right around the bony area, the wrist.
Yeah.
Move it up your forearm. Move it into a meatier, move it up higher, move it into a meatier part of your forearm, and you'll likely get better contact. If you have the financial means and you're comfortable using technology, a chest strap based heart rate monitor is consistently the most
Okay.
accurate and reliable way to monitor your heart rate. The wrist based, they're really algorithms. The risk based algorithms do have some error, especially if they're not getting good data because the contact isn't right or anything like that. But yeah, a chest strap is the most accurate and reproducible. You can get lots of different companies make them. In fact, we just got a bunch for our clinic at around like the $50 mark. There are
Okay.
some that are hundreds of dollars, but we test all of the ones that we use and they are reproducible against the more expensive ones. So you don't need to break the bank to get one of these
Okay,
devices.
may I know what brand that is? The $50 thingy?
Oh, what I will do is, because I would not like to be on record promoting any specific
Understand.
brand, what I can do is I can share some of the brands with Shannon, and then she can circulate as part of some of the supportive information that that she sends around after the talk.
Okay, thank you.
And I hope that's okay.
Sure, sure.
I have no endorsements, my friend, and I don't want to advocate for different for-profit companies over others.
Do you have any links or anything to different, it's not the aerobic exercise, but the other exercises?
Resistance?
Um, if someone wanted to do it at home?
There are many ways to help support people doing resistance exercise at home. May I just ask more specifically, what are you looking for? Are you looking for people to help you with it, or apps to help you with it, or what? What?
Sorry.
No, please.
Just like the correct way to do certain stretches or lifting and how many reps, that kind of thing.
Yeah. So, Shelley, we don't know each other obviously, so without knowing anything about your background and the safety and everything of resistance exercise for you, the default generic answer is almost always more consistently safe and helpful to find a professional in your area to engage with. Now, that kind of advice can be done remotely. Like for example, at our clinic, we have people from Barrie and London who are working with us remotely, and we're remote supervising sessions. But if you have the resources available to you, finding someone in your local community or someone that you can connect with virtually will almost always be your safest way to learn any of these things. Because even if you're looking at an app or a YouTube video on how to do it, unless you're doing it in front of a mirror where you can compare your movement pattern to what you're seeing on the video, that would be probably the next best thing. So if you don't have the means to engage with a professional, finding good instructional videos and being able to see yourself while you're trying to reproduce those movements would be your next best bet. Does that get at what you're asking, Shelley?
Yes, thank you.
Of course. Any other questions? Shannon, I think I put everyone to sleep.
No, not at all.
Maybe there's a sleep module that I should be doing my presentation to help support.
Well, if anyone does come up with any questions after the fact, you have my email. And when I send around the materials, if you have any questions, feel free to send them back and I will get them over to Scott for you. And then hopefully it'll get resolved for you.
Similarly, I mean, there's my contact information. It'll go out. Feel free to reach out directly if people have specific questions.
All right. Well, thank you everyone for joining us this evening. Just like the rest of the presentations, I'll send around all the materials and the recording. And I hope you will join us next week. So next week we will have a presentation by our genetic counselor, Sarah Muir, and she does a great presentation on genetic factors related to cancer and ones that you may want to learn more about if it affects you and your family. So I hope you can join us next week. Thank you, as usual, Scott, for joining us. And I hope everyone has a great night.
Thank you.
Thank you.
Thanks, everyone.
All right.